Now, women groups and representatives of civil society organizations led by the Women Advocates Research and Documentation Center have appealed to Lagos State Governor Babajide Sanwo-Olu to reinstate the suspended guidelines on safe termination of pregnancy. The groups in a webinar said the guidelines are important to make provision for termination of pregnancy in cases of incest, rape and sexual and gender-based violence. They highlighted that there has been a rise in the number of rape and incest cases leading to pregnancy and that by law, these victims, including children, are unable to access safe abortion services. Following public criticism, the Lagos State government suspended the guideline exactly 1 week after its launch on June 29, 2022. In her remarks, the founding director of the center, Abiola Akiyode-Afolabi, emphasized the need for the government to prioritize women's health, rights and lives, despite the sentiments that may surround the matter. To discuss this, we are joined by Wemimo Adewuni, Media and Communications Manager, Women Advocates Research and Documentation Center. Thank you so much for joining us on the news.
Thank you for having me.
So aside public criticisms, were there other primary reasons behind the suspension of the guidelines for safe termination of pregnancy by the Lagos State government?
No, we have no clear indications, but we believe that the suspension rode on the elections, the pre-election sentiments that religious persons were able to write to influence the governor. Remember, the governor himself had signed the guidelines, and the guidelines were created by the Ministry of Health alongside the gynecologists and obstetricians, as well also as the Nigerian Medical Association. So we believe it was the intricacies around elections that influenced the governor to suspend the guidelines. Aside this, there are no health reasons for those guidelines not to exist.
Okay, let's now look at the specific provisions within the suspended guidelines that address termination of pregnancy in cases of incest, rape, and sexual and gender-based violence. I'd like you to elaborate more on that and why it is considered important for the safety of the victims, are actually mostly women and female folk, the girl child.
Thank you. So of the total number of maternal death, that's maternal mortality in the whole world, Nigeria contributes 10%. That of all the countries in the world, only Nigeria contributes 10% to maternal death all over the world. This number, when we track down, we see that unsafe abortion play a big role in cases of maternal death. We also looked further down and found that there is an increase in cases of rape and incest, and of course sexual and gender-based violence, especially after the COVID-19 lockdown. We see more cases of fathers raping their daughters, cousins, incest cases and rapes. And we find pregnancies coming from these issues, including gang rape. All of these many times lead to pregnancy. And as a society, we're actually very shy from talking about these issues. But women who are ashamed and who are already shamed for being raped are then left to no choice than to go to quacks, living their lives at risk. And they either die or they have terrible health complications.
Now, you've mentioned instances of sexual violation. Let's look at the issue of rape and incest. What are the major rising or causative factors of this particular kind of atrocity being committed against the female folk?
So we work with a lot of partners, including the Mirabel Center, Mary Stokes, and so many other women-inclined CSOs and NGOs. And we see a rise in cases of incest, like I said earlier, and gender-based violence. The causes are very interwoven, and it's deep research to find out. So at first level, we can identify economic challenges contributing to gender-based violence. Again, very significant was the lockdown, the frustrations from the lockdown. There was an increase in the reporting of cases of sexual and gender violence. Again, from these rape scenarios and incest scenarios, we see pregnancy. So most conversations end with the rape and the incest or sexual and gender-based violence. But what happens to the woman after the incident? when she's left to herself, what choice does she have if she finds out that she's pregnant after being gang raped? What does she do? Those are the questions that we attempt to answer and that the guidelines provide for.
Finally, before I let you go, then, what do you think the government can do, or how do you think the government can now prioritize the health and the lives and the safety, including the rights of the female folk against such situations? Or if they get into such situations, how can we begin to help them get out of it or have access to healthcare services?
So elections are over. It's time to stop playing games. It's time to bring back the guidelines. And what the guidelines do is to ride on the existing laws, which includes the criminal law of Lagos. Section 201 clearly then helps doctors to see that they can lawfully carry out abortion services for women who are victims of rape, especially for women who have physical health challenges. Before now, doctors were careful because of the general law threatened to jail doctors who offer abortion services. But a woman who has health challenges, including heart issues, kidney issues, blood issues, who's unable to support the pregnancy, should be able to have access to safe abortion within the medical space. So we're saying that the game is over. It's time to roll up the sleeves and realize that women are dying. We need those guidelines brought back, and we also need more enlightenment so that Lagosians can know that this is now accessible to them. If a girl has been raped, she can access safe abortion services. We no longer need to talk in posh tones. Women are dying, and it's time to take the decision right now to popularize the guidelines and to bring it back.
Wamima Adewini, thank you so much for sharing your thoughts with us.